Most people know to look for lumps in their breast as a potential sign of breast cancer, but did you know there are other less common symptoms you should also be aware of? In this video, we'll explore these uncommon signs so you can stay informed and vigilant when it comes to your breast health. Hello and welcome back to Mimi's Health Hub, where we empower ourselves to optimal health, one system at a time. For a brief overview of what breast cancer is, I'm sure a lot of us have heard it before. Breast cancer is a type of cancer that forms inside the cells of the breast. It is the most common form of cancer among women worldwide, and the exact cause is unknown, but there are several risk factors that predisposes women to breast cancer, and they include genetic mutations, family history, age, and certain lifestyle factors such as drinking alcohol and smoking. The most well-known and most common symptom of breast cancer is presence of lump or a mass in the breast. However, it's crucial to remember that breast cancer can, present itself in various ways, and a lump is just one of those very many potential signs of breast cancer. Let's quickly review the common symptoms before we move on to the uncommon symptoms. And first, the lump in the breast or a mass in the breast or underarm. The next common symptom is changes in breast size or shape. The third is the generalized breast pain. Fourth, nipple discharge. Fifth, redness or flaking of the breast. Now let's delve into the lesser known symptoms of breast cancer that often go unnoticed, and they include inversion or retraction of the nipple. If you notice that your nipple is turning inward, okay, and has become inverted when it previously was not, this could be a sign of breast cancer. And this symptom can indicate that a tumor is present directly behind the nipple, causing it to pull inward, hence the inversion. The next is unexplained unusual discharge from the nipple, especially if it's clear or bloody. And this is another symptom to be aware of. While discharge can be due to benign conditions or even breastfeeding, it should always be evaluated by your healthcare provider to rule out any form of breast cancer. The third is dimpling or pitting of the skin, also known as orange skin texture. This is when the skin of the breast takes on a texture similar to that of an orange peel, okay? And this can be a sign of inflammatory breast cancer, which is a rare but very aggressive form of breast cancer. There is also persistent redness, crusting or scaling of the skin of the breast, especially around the nipple. It could be indicative of Paget's disease of the breast, and this is another rare form of breast cancer that starts in the ducts of the nipple but extends to the nipple surface and areola. The next point is swelling in or around the breast, collarbone, or armpit. This indicates that the cancer has spread to the lymph nodes in these areas, causing them to swell. And note that the swelling can also occur without the presence of a distinct lump. This simply means that you don't only look out for a lump or a mass in the breast. You could look out for other forms of swelling within the armpits, within your collarbone, to check if there's any form of swelling. So you don't just dwell on, oh, there is no lump in the breast, so you're fine. You have to also look out for the surrounding areas of the breast. Next is persistent pain. While breast pain is not usually a sign of cancer, consistent pain in one spot that does not go away no matter what you take should be evaluated immediately by your healthcare provider to rule out breast cancer. The next sign is unexplained changes of the breast. And this has to do with when one breast starts looking significantly different from the other or asymmetrical to the other, and it can be a sign of breast cancer. So it's very wise to pay attention to any noticeable changes in the size or the shape of your breast that doesn't have a clear cause. There are some people that are born naturally with one breast bigger than the other, but whereby you haven't noticed such changes before, I think you should get it checked immediately. The next is thickening of breast tissues or skin, and this can be a warning sign, okay? This might feel like an area of the breast that is denser and harder than the surrounding breast tissue, and this thickening can be an indication of a tumor present or an inflammatory process. Normally, when there is inflammation, the body has its inflammatory response that it gives, and increased temperature is one of those inflammatory response, which leads us to our next point, being unusual warmth that is higher than the body's normal temperature. And this unusual warmth will be situated around the breast. This can be a sign of inflammatory breast cancer. Like I said earlier, during an inflammatory process, the body temperature tends to increase due to its inflammatory response. Our body is made to survive, so that's survival mode kicks in, and then it starts, fighting against whatever the case may be, so which would lead to an inflammatory response. This symptom is often accompanied by redness and swelling. Okay, so the next point is persistent itching. While itching can be related to skin conditions or allergies, persistent itching that does not resolve with topical treatments, okay, could be a sign of inflammatory breast cancer. Early detection of breast cancer can significantly increase the chances of a successful treatment. Regular self-examination and being aware of the uncommon symptoms can lead to earlier diagnosis and better outcomes for everyone. Remember to perform your monthly breast self-examination, especially during your monthly flow, okay? Schedule regular clinical breast exams and mammograms as recommended by your healthcare provider. If you notice any of these uncommon symptoms, it's essential to consult with your healthcare provider immediately. Do not wait until your next scheduled appointment. You have to reach out immediately, like I said, and get it checked as soon as possible, as early intervention is key to managing cancer as well as any other health challenges. For a quick summary, breast cancer can present with symptoms beyond just the lumps. Secondly, uncommon symptoms include nipple inversion, unusual discharge, dimpling or pitting of the skin, persistent breast pain, unexplained changes in the size and shape of the breast, thickening of the breast tissues, unusual warmth, and persistent breast itching. I spoke about early detection through regular self-exams and medical checkups, and this is very crucial for your health. Consult with your healthcare provider promptly if you notice any of these changes, be it the usual changes or the unusual changes. Please try and get it checked as soon as possible. With that said, thank you for watching this video and getting to this point with me. A round of applause to you, and don't forget to subscribe to this channel and hit the notification bell for more health tips and information. Share this video with your loved ones, your friends, and always stay vigilant about the changes that might occur in your body, because as human beings we grow, we change, so change is something that would always occur. If you have any questions or need more information, don't hesitate to leave a comment below. Stay healthy and informed. Take care of you, and see you in the next video. Bye bye.